So you took a foray this year into a very cool new arena, which is sort of an antioxidant defense serum, which you call Defense C. So first of all, why did y'all decide to do that? Such a diversion
Yeah.
from your usual.
I mean, great question. And, when we think about uh, this kind of staples in skincare, right? And what do we need to do? One is, a good antioxidant to help prevent oxidative stress caused by, UV exposure or different environmental triggers. And with that, you get the release of the, advanced glycation end products, AGEs that can damage the skin cell and so much more that's going on. And so vitamin C type products, antioxidant products are one of the staple products in a portfolio and in a regimen. And that was missing in ours. But we wanted to do it a little bit different. So we take our HSA molecule, pair that with 20% THDA, the tetrahexyldecyl ascorbate. And
Tongue
then,
twister.
yeah, I know it. I practiced that for a while. And then a proprietary antioxidant blend as well that works synergistically with the THDA. So what you really get is, a really nice formula that's a powerhouse antioxidant, and we've got some really nice both ex vivo and in vivo clinical studies to show the benefits of this, but very gentle. Because of some of those properties that you mentioned with the heparan sulfate analog that's in Sente, helps to defend against some of the irritation that you can get with a vitamin C, even a THDA.
Yeah, any of them can be irritating. So talk a little bit. The ex vivo work was really interesting, and that I think really proves how protective and what a great antioxidant defense serum it really is.
Yeah, it was fascinating, and it was the first time I was directly involved in a study like this, and it was really cool to see just with one application. So you take a strip from one patient donor site of tissue, and you take basically 3 punches for each test you want to do. One is the control. Then one you're going to hit with UV light to stress the skin, if you will, and the cells. And then the last, apply our product and then stress it with UV light and see what happens. And the goal is to measure certain markers that are basically indicative or show that there's stress to the skin,
right,
and some bad things. And so we did repeated that 3 different times, looking for 3 different markers. The 4-HNE, which is oxidative stress. We also looked at the gamma H2AX, which is indicative of DNA damage.
Right.
And then we also looked at the upregulation of the AGEs.
Yes.
And across the board, what we saw was from baseline, if you looked at the tissue that did not receive one application of the product, there was a statistically significant difference from the baseline tissue as far as the expression of these different markers for
after
stress.
UV exposure.
Exactly.
They jumped up quite a bit.
But looking at the tissue that got one application of our Defense C product, there was no appreciable change from the baseline tissue in any of those markers, meaning, at the end of the day, what does that mean? We are able to defend against that and prevent some of these stressors that then ultimately, for the listeners and the people at home that say, well, what's this mean for my skin? It helps to prevent that damage that shows up as redness or uneven skin tone, textural changes in the skin.
Right.
That's the benefit here.